Hello students. Now I am going to discuss about some classes of sedative and hypnotics. There are mainly four basic classes of sedative hypnotics are benzodiazepines, barbiturates, non-benzodiazepine hypnotics and miscellaneous. First of this class are benzodiazepines. Based on duration of action, these classes are subdivided by three classes. A long duration of action, which is basically stayed for 1 to 3 days. Diazepam, nitrazepam are from this class. An intermediate of action generally persists for 10 to 20 hours. Examples are alprazolam, lorazepam. Next are short duration of action drugs, which are generally persist for 3 to 8 hours. In this group, oxazepam, triazolam are based. Next, main class of sedative hypnotics are barbiturates. Based on duration of action, this group also subdivided in three basic groups. A long duration of action generally persists 6 hours or more than this. Barbital, phenobarbital are this group of drugs. And intermediate duration of action drugs generally persist 3 to 6 hours of action. Amobarbital, talbutal is an intermediate duration of action groups of drug. A short duration of action generally persists less than 3 hours. Pentobarbital and secobarbital is the group of short duration of action barbiturate drug. Now, non-benzodiazepine hypnotics groups of drugs are zolpidem, zopiclone, zaleplone, esopiclone. Next groups of drugs are miscellaneous. They can be several groups of several disease classified drugs. They are generally chloral hydrate, promethazine, neuroepileptics, or opioids. The mechanism of benzodiazepine or barbiturates generally same duration or same process. Benzodiazepines facilitate the action of GABA. They potentiate inhibitory effects of GABA. Barbiturate or benzodiazepine first of all bind to GABA A receptor at different allosteric sites of GABA. Benzodiazepine receptors generally bind to chlorine channel complex, which increase in frequency of opening of chlorine channel, or the increasing dose mainly facilitate the function of GABA. After that, increase in GABA mediated chloride conductance, barbiturate increase duration, and benzodiazepine increase frequency of opening of chlorine channel. Next step is membrane hyperpolarization, which takes place by both drugs, barbiturate and benzodiazepine as well as. Next step, CNS depression. In case of benzodiazepine, increase the frequency of opening of chlorine channels induced by GABA, where barbiturate increase duration of opening chlorine channel induced by GABA. In case of barbiturate, at higher concentration, it can directly increase chlorine conductance through chlorine channel by GABA mimetic action, and inhibit calcium-dependent release of neurotransmitter, which depress glutamate-induced neuronal depolarization through AMPA receptor. In very high concentration, it can be used anesthetic dose, which regulate depress voltage sensitive sodium and potassium channels. Here some advantage and disadvantage we also call, but here is some advantages of benzodiazepine over barbiturates. Benzodiazepine is less neuronal depression or it high therapeutic index helps to use minimum use of dose. But in case of barbiturate, it is more neuronal depressor. In case of benzodiazepine, no anesthesia even at high doses takes place. Patient can be aroused. In case of barbiturate, it directly helps to loss of consciousness. It may be a disadvantage of barbiturate, and also it is a low margin of safety. No effect on respiration or cardiovascular function at high hypnotic doses takes place in benzodiazepine group of drugs. But in case of barbiturate, it can be causes of respiratory and cardiac depression. Benzodiazepine generally does not affect on REM sleep, which I have told you earlier, rapid eye movement sleep. It less distortion of normal hypnogram, where barbiturate increase suppression of rapid eye movement sleep, which withdrawal, rebound, increase in sleep. Some other cases, it also produce hangover. Benzodiazepines abuse liability very low, but in case of barbiturate, it produce tolerance and dependencies. In case of benzodiazepines, there is no hyperalgesia takes place, but in case of barbiturate, it induce or increase hyperalgesia, which means sensitivity to or sensitivity towards pain. In case of benzodiazepines, amnesia without automatism, but in case of barbiturate, amnesia with automatism or loss of short-term memory. In case of benzodiazepine, not enzyme inducers, less drug interaction. In case of barbiturate, potent enzyme inducers takes place for more drug interaction. Specific agonist of benzodiazepines used as flumazenil. In case of barbiturate, there is no other antagonists are available.